Hi guys, your presentation was really good. I think you guys included a lot of good information. Teaching adolescents, I think, can be very challenging, especially because at this age, they're really starting to explore that autonomy, and we all know teenagers, they like to think that they know it all, and that they are right and that you don't know anything. Um, so it's like an interesting age, I think, especially when trying to give, patient education. Something that I think is very important to be teaching kids at this age is, teaching about sexual behavior and teaching about, STIs. I think a lot of younger children, you know, that experiment, they only worry about pregnancy, which obviously is an issue, but I think they forget about possibly contracting, an STI. So many sexually active young people engage in behaviors that put them at risk for these STIs and even pregnancy, such as having, multiple partners that they're having sex with, or having sex without a condom, or other forms of contraception that are just not being used or not being used properly. Approximately 15% of U.S. high school students reported having had four or more sexual partners during their lifetime, which is quite a bit for kids that are this age. Among the sexually active students, nearly 62% reported using a condom during when they're in the most recent experience of intercourse, and 18% reported using birth control pills at the time of their most recent experience of intercourse. Since 2003, however, rates of oral contraception use have been declining, especially amongst adolescents of the Hispanic and African American descent. And condom use appears to be decreasing as well, which is not good, which kind of helps explain the trend that we're having right now in the rise of teen pregnancy. So that's why, education to this group of people is very important. Um, I think it's important as nurses, to be attaining a sexual history is very going to be very important during these health meetings. And since it's such a sensitive type topic, questions about sexuality should be prefaced with like an explanation of their purpose and the limits of the confidentiality. Initially, you can cover less, sensitive topics maybe, and then such as like milestones in puberty development, and for girls, maybe their menstrual history. You can also kind of like ask questions about address their dating behaviors, and then maybe see if they have any sort of same sex attraction as well as opposite gender attraction. Um, and I think it's important that sexually active youth should be asked about their consistency and motivation to use condoms and other kind of barriers for preventing STIs. And I think it's really kind of important for us to be doing teach back methods. Kind of like asking them like, what do they know about STIs? Like, what do they know the symptoms? Do they know what the main prevalent ones are? So that we can actually really kind of assess what their knowledge is. And then from that, we can see if these kids need to be screened then for STIs, and kind of explain to them what the screening process is, and um, that if they do get screened for this, they're not going to get in trouble, and that just kind of really emphasize that, that patient confidentiality, just so that they can trust you, just that we can see a decrease in these STI numbers as well as these unwanted pregnancies. Thank you.